just before their talks, but again, I'd like to introduce the people behind the scenes without whom it would not be possible to have these series of webinars. So first of all, we've got Dr. Valentine Gua, who's CamDocUK Education Secretary, and is the man responsible for putting together this webinar and all our other webinars we've had. He's a consultant physician in elderly care and acute medicine at Mid Yorkshire Hospitals, NHS Trust Wakefield. So, did you give a wave, Vali? Good. And next, behind the scenes, we have Dr. Anna, who's CamDocUK Social Communication Secretary, and is basically our tech whiz. Without her, there would simply be no CamDocUK webinars. She's a specialist doctor in chemical pathology in Pinderfields in Yorkshire. So, Anna, give everyone a wave. Fantastic. And so we'll kick off with our first talk. And as usual, what I will ask you, the audience, to do is, if you have any questions, to put them in the Q&A, ask them using the Q&A tab. And we'll try to answer as many of your questions as we can on air. You'll probably also be getting some responses from our behind the scenes people. So our first talk is going to be delivered by Dr. Humphrey, who's a consultant psychiatrist with a special interest in intellectual disabilities. He's been a member of the Royal College of Psychiatrists since 2013. He's currently working at St Mary's Hospital, Kettering, which is part of Northamptonshire Healthcare NHS Foundation Trust. And he'll be talking to us today about the impact of COVID and its measures on mental health. So, Humphrey.
Hi, thank you, Johnny, and good evening, everyone. And pleasure to, speak to you guys today. So like Johnny said, I'll be talking about the combined effect of the pandemic and the restrictions that have been put in place on our mental health. And I'll also talk about the direct effect of the virus on the brain. We now have some results from post-mortem studies that show that COVID-19 can directly infect the brain, and there have been some reports of a number of neuropsychiatric manifestations that have come about from the direct involvement of the virus on the brain. So I'm going to talk about that, but that's going to be at the end of the presentation. Before I proceed, I just want to say I have no conflict of interest to declare. So, I think it is common knowledge that some of the restrictions that were put in place to limit the spread of the virus led to significant disruptions in our usual activities. And I think it is fair to say that in some cases it required huge changes and adjustments to be made in our lifestyles. And I can think of at least 5 different ways in which the combined effect of the pandemic and the measures that were put in place could affect your mental health. And these 5 different ways haven't just been plucked from the thin air. These are well-recognized, discrete social experiences that could elicit a stress response or a psychological response from an average individual, irrespective of whether there's a pandemic or not. So if someone should walk into my clinic and I became aware that they've had a recent exposure to any of these stressful life events, I want to keep a close eye on them because I'm very much aware of the different ways in which it could play out in their mental state. So I'm talking about things like a recent experience with the death of a loved one, which was the case during the pandemic. I'm sure some of us could relate with that. I'm talking about things like job loss, which again was familiar. We could relate with that as well during the pandemic. I'm talking about things like when there is a significant disruption in your routine for those who are routine dependent. I'm talking about things like when there is a significant interference in your support system for those who depend on that support system to get by. And I'm talking about things like when there's an imposition of self-isolation on you. So I'm going to try and go through each of these stressful life events briefly and explain how it could play out on your mental state. I'm pretty sure some of you watching me may have sadly lost loved ones during the pandemic. And you would agree with me that it has been extremely difficult to grieve given the current circumstances. And because some of the restrictions that were put in place made it practically impossible for us to grieve in ways that we are accustomed to. And as a people, there are certain norms, certain rites and ritual, traditional, cultural, religious rites and rituals that are an integral part of how we grieve. And these rites and rituals are very important because they make it easy for us to achieve closure, for us to heal, and for us to move on with our lives. So something as simple as you watching the casket of your loved one being lowered into the ground, and something as simple as you having 5 minutes to talk or say a simple prayer with your loved one before the casket is wheeled away could go a long way to help you with your healing. And sadly, during the pandemic, most of us were deprived of these opportunities to achieve this sort of closure. And I'm pretty sure that what could happen is that we could end up with things like a prolonged grief reaction, or some of those who are grieving may end up with a complicated grieving process. So someone could ask me, how long should a normal grief process last for? So it depends. Some people could take 6 months to grieve, others could take several years. And rightfully so, people should be given the time and space to grieve, no matter how long it takes. What is important is that the grief reaction should soften over time. So the way you feel at 6 months should be less intense than the way you feel at 2 weeks after you've lost a loved one. And the way you feel at 2 years should be less intense than the way you feel at 6 months. So as long as the grief reaction or the grief process is softening over time, then you're grieving okay. I mentioned complicated bereavement. So this is when you're in a persistent state of mourning and your symptoms don't lessen over time. So you're still consumed with intense sorrow, you're still preoccupied about your loved one, and you're unable to focus on anything else. So if that is you, then you're not grieving in a normal way, and you may need additional support to get by with the grieving. The next psychological effect I'll talk about is the fact that some of us sadly lost our jobs during the pandemic. And I guess it is common knowledge how that could play out. So it could lead to things like financial constraint. It could take a toll on your self-esteem. It could cause problems in your friendships and relationships. And to those who have anger issues, it could play out in acts of violence and aggression. And to those who are vulnerable, you could see a situation where they tend to things like alcohol intake and substance misuse, and so on and so forth. And I don't want to come across as a doomsayer. So I'm pretty sure that, most of us who experience these life events will cope really well. I'm very much aware of how remarkably, resilient we are as a people. So most of us will do very fine, irrespective of these life events. The point I'm trying to get across is that there are some of us who are vulnerable, and it's important we understand the extent to which it could play out in these people. So most of us will do very fine. I'm not in any way suggesting that if you lost your job overnight, you're going to become violent. Okay. The next issue I'm going to talk about is just how changes in our routine may have impacted on our mental health. So I work with people with intellectual disabilities and autism, and to these guys, a clear, consistent, predictable routine means the world to them. And even the slightest change in your routine could lead to, a sense of confusion, could lead to incidents of challenging behaviors. And that is because most of these guys, especially those of them at the severe end of the spectrum, so those of them with severe learning disability and severe autism, they think in concrete terms. So I explain what this means. So they can only relate with things that they could see, things that have a physical presence, things that they could see, they could feel, they could smell. And if this is the maximum capacity of your reasoning, it makes it difficult for you to cope with changes in your routine. Contrast that with you and I. You and I are abstract thinkers. So abstraction is the ability to understand that things can exist even when they're not physically present. And this deeper level of thinking make it easy for us to cope with changes in our routine. I'm pretty sure some of you watching me haven't been to the restaurant since the outset of the pandemic, but you know that the restaurant still exists. It's existing in your mind, and you're able to understand that you can still go there even though you haven't been there. Sadly, most of the people I work with, most of them will think in very simple terms, I was able to figure this out, and this makes it very difficult for them to cope with changes in their routine. The next life event that we experienced was the fact that, for some of us, there was a significant interference in our support system, or in some cases, there was even a discontinuation of the support network. So your support system referred to people in your life that help you achieve your objectives and goals. And to some, these objectives are, support with their medication. To others, it is about planning their days. To others, it is even about helping them engage with their risk management plan, with their suicide prevention plan. So you can imagine the effect, that a discontinuation or an interference of this network could have on their mental health. And the last item I'm going to discuss is the effect of social isolation on our well-being. We know that we're social beings, so instinctively we want to intermingle and interact with each other. We know the benefits of social interaction. It creates a sense of safety, well-being, and belonging. We know that it provides opportunities where we can share our thoughts and feelings with others, we can confide in others, and vice versa. And when you interact with others, it also provides opportunities where you can test some of the doubts that your brain may cast on your mind with others. So the brain can sometimes play tricks with your mind. So the brain can sometimes try to convince you, for example, that you're a horrible doctor, even when you're not. And the brain can go ahead and only be very selective in the memories that it presents to you. So if you have opportunities to interact with others, you could check and test the validity of these doubts that the brain is casting on your mind. However, if you're isolated, then it's likely that some of these doubts could take hold and dominate your life and get out of hand. Okay. I'm pretty sure some of you watching now will be wondering how all of these translate into a mental illness. So most mental illnesses, and there are about 200 of them, most of them result when your genes come under stress. So whether it is depression, anxiety, whether it's panic disorder, whether it's the different phobias, whether it's schizophrenia, whether it's bipolar affective disorder, whether it's personality disorder, whether it's eating disorders, all of them occur when your genes come under stress. So these genes are genes that you've been from your parents that increase your risk of developing a particular mental illness, or genes that have been altered within you. So you inherited normal genes, but for some reason they were altered within you, and that increased your risk of developing a mental illness. So for example, if I have the genes for schizophrenia, every time I go through a stressful life event, the risk of me becoming symptomatic is increased. It's not a given that I'm going to develop the symptoms, but the risk is going to increase. And it follows that the more genes you have for a particular condition, so most psychiatric illnesses occur from many different genes acting together to increase your risk. So the more genes you have, the smaller the stress you may require to have a breakdown. And the smaller the genes you have, the larger the stress you may require to have a breakdown. As you can imagine, during the pandemic, we have been inundated, we have been flooded with stress. So even those who have very little genetic predisposition have had a breakdown. And this is what we're seeing in clinical practice. So compared to previous years where there was no pandemic, we're seeing higher rates of new onset mental illnesses, ranges from, depression, anxiety, new onset psychosis, new onset PTSD, etc. What we're also seeing is that those who were previously well, either on medication or without medication, they're having a relapse, they're having a recurrence of their symptoms. And if you speak to colleagues within addiction psychiatry, they will tell you that they're having high incidence of substance misuse and alcoholism. Colleagues within safeguarding will tell you about high incidence of domestic violence and spousal abuse. So you can imagine how stretched the system is. And from all indication, it looks like we're going to be in for a long haul. I'm very mindful of time. So briefly, just talk about the direct effect of the direct effect of the virus on the brain. So we've had some reports from post-mortem studies that show that the SARS-CoV-2 virus, that's the virus that causes COVID-19 pandemic, can actually infect the brain. It can cause inflammatory changes or swelling within the brain. And there have been reports of new onset psychosis. There have been reports of altered mental status. So what it means is that some people have presented with, confusion and disorientation because of that. And there have also been some reports of cerebrovascular events. And among those who have tested positive of COVID, who were treated and now negative and will continue to have the symptoms, I think they refer to them as long haulers. There have also been reports of some psychiatric manifestations like depression and anxiety. But at this point, we don't know whether that is as a result of a direct effect of the virus on the brain or whether it is just a reaction to the illness. I guess my time is up. Thanks for listening. I'm going to stop at this point and see you guys at the Q&A. Thank you. Back to you, Johnny.
So thank you very much, Humphrey, for that really interesting talk. I don't think we've had anything come through the Q&A yet. So what I'll do is I'll take moderator's prerogative and ask you a question myself. Okay. So you mentioned that a lot of what's happened to us over the lockdown could trigger, a psychiatric illness in somebody who, has the propensity, but otherwise has been ticking along, under normal circumstances. So we've heard, reports in the papers, in the news about increases in domestic violence, child abuse, things like that. Do you think that this will be taken as a mitigating circumstance in court when people are when people are going to court for these sorts of misdemeanors? Do you think they'll be able to turn around and say, well, it was because of the impact of lockdown?
I think the answer is yes and no. So if at the time of committing the act, you have an impaired reasoning or a disability of the mind, then that will be taken into account. So for any time you commit a crime that the crime was committed under the influence of a mental illness, then of course the judge will take that into account. And with regards to the mitigating circumstances, I don't think it really matters. What matters is what was your state of mind at the time of committing the crime. If you were at any point influenced by the mental disorder and mental illness, that takes into account the outcome of the judgment. So it will be a long stretch for your attorney to use COVID as an excuse. If at the point of committing the violence or the act, it's not proving that you had an impaired sanity.
Okay, thank you. Very interesting. So we'll move on to our second talk, and this is going to be delivered by Dr. Nkwayep Mpafe. Now, some of you may probably know I work at the Queen Elizabeth Hospital in Birmingham, in part of University Hospitals Birmingham NHS Trust, and the Queen Elizabeth Hospital is actually the Royal Centre for Defence Medicine. So, basically, we have the Army, the Navy, the Air Force, all of the doctors train with us, and when this, the personnel get injured abroad or unwell abroad, they get evacuated straight to us. Now, Dr. Mpafe is a GP for the Ministry of Defence, and so he basically works at the Queen Elizabeth Hospital, looking after these people, and his special interest is in substance abuse. So what he's going to talk to us about is how to spot the signs of mental illness and how to help our loved ones. So, Dr. Mpafe?
Thank you, John. Let me just log in. Can you see it? Presentation slide. I have some slide.
We can see.
Okay. Can you see it? Okay. I'm going to talk how to spot mental health and how to help our loved one when they do have it. What to do when they don't want help, as it happens in our community. Now, I would focus my mind into two aspects of mental health, anxiety and depression. We'll just mention about self-harm and suicide because that is very important. How to spot anxiety. First of all, I need to precise that anxiety is a normal response to the body when under stress. I'm sure we all have had our own share of anxiety. It happens in a daily basis in various degrees to all of us. One is afraid or apprehensive about the unknown, the future, or what is to come. These normal emotions about feelings of tensions, worrying thoughts, and at times physical changes such as high blood pressure, tummy ache, loose bowel, sweating, tremor, or frequent voiding, which means that people urinate. When we're a bit anxious to go to a meeting or to go to an interview, for example. Now, imagine being on that anxiety state for a prolonged period of time. I mean more than 2 weeks. This will have an harmful effect on our well-being. I would urge you to trust your own judgment when it regards to the normal habit of our loved ones, which should be in our guard when those changes occur and last more than 2 weeks. When we notice that, it becomes difficult to be around them as they get upset or become annoyed easily. Alarm bells should ring when we take extra caution not to upset them. When we have to think how to approach our loved one so that they might not become irritable, angry, aggressive, and at times having tantrum towards us. That should actually ring alarm bells to order something is wrong. When our loved one need reassurances all the time because they have doubts and need guarantee from us to feel safe, that also should be an alarm bell. We could see changes on their personality, beg your pardon, because we know them. Those who are easygoing, for example, becoming very picky and needing a lot of details on things. This might be because they're trying to keep their mind occupied. They could take long time to make decisions on matters, whereas before they would just make the decision quite quickly. They may avoid or leave places or people when they meet people, or situation or crowd. This is actually a defense mechanism not to have those awful type of feeling of anxiety that could be debilitating, as with panic attacks. As with panic attack, this could also ignore those around them, not picking up the phone, for example, or trying to stay alone. They may have negative thoughts and feeling that something awful is going to happen. And as they always think negatively and interpreting things as harmful, even if they're not. An anxious mind is always on the guard, always sees the worst case scenario. They could become easily emotional, such as bursting into tears when alone or in certain situations. This also is an alarm bell that they might have anxiety, depression, or other mental illness. Physical symptoms is always at times present with anxiety, some of which can be very painful and frightful, such as chest pain, chest tightness, palpitation that could induce pain, and headaches, muscle tension that could also cause pain, and tummy ache. Other physical symptoms, such as sweating, which we could all relate to, hot flushes when women in their menopause age would actually tell you how awful it feels. Dry mouth and feeling sick. Pregnant women would tell you how feeling sick would actually affect their day-to-day life. Where there is anxiety, there is often tummy trouble, such as constipation, diarrhea, or irritable bowels. When our loved one seems to become forgetful, scatter, or inattentive, anxiety may be the reason for that behavior. They may have trouble focusing on you, the family, or completing tasks, or during conversation. This is because their mind is worried about the past, what if, and the future, rather than being on the present. How to spot depression? Now, we need to first think what everything that happens with anxiety could also happen with depression. But what is depression? Depression is when the way we feel start to make our life more difficult, or having low mood lasting for more than 2 weeks. It affects those around us. When we have
Recording stopped.
When we have a loved one that is depressed, it also affects
Recording in progress.
Some people with depression may try to hide the sign from others, or they may not even realize that they have depression. Eating too much as they are taking food for comfort, or eating too little due to low mood, they could lose weight, or they could increase weight because they're eating too much. Other diseases could also do that. We should be mindful of that depression may be the case here. A lack of sleep can contribute to depression, and depression can make it more difficult to sleep. Sleeping too much is also an alarm bell, mostly when our loved one is making some few nap when they used to just do their things. Loss of libido is a lack of interest in sex, could be a subtle sign of depression. Fatigue is a very common sign, symptom of depression. Those with persistent tiredness should be investigated to ascertain the cause of depression or the cause of that tiredness, because there are a lot of other issues such as anemia, a thyroid problem that could make people tired. So it's always good to tell your loved one to go and investigate the reason why they're feeling so tired. They might increase, as the previous speaker said, Dr. Humphrey, the usage of alcohol or smoking or substance misuse to cope with their feeling of sadness and hopelessness. Other may feel that they could do self-harm or commit suicide. Sometimes they change by becoming more realistic than others, but most of the time they're pessimistic about the future. We might notice often that during conversation, they're quieter and then hesitate until they stop speaking or loses the train of thought. It can indicate issue with memory and concentration, which is a common symptom with depression. Loss of interest in pleasurable activity, not getting any pleasure of life, feeling anxious all the time, having difficulty in making decisions. and they could also feel bad about themselves that they're not able to help their family. Mood changes such as anger, outbursts, irritability, and tantrum are not unusual and can be a sign of depression. Restlessness and agitation also could be a sign. Low self-esteem, withdrawing from others and friends and family, feeling guilty as if everything that goes wrong is their fault. Depression also could have physical consequences like backache, chronic pain, unexplained physical ache and pain, headaches, and also digestive problem that I mentioned before. Now, how can we help someone with anxiety and depression? We have to listen to them. We shouldn't judge them or we should acknowledge what is going on, being very patient, not to put pressure on them. Do not avoid them, because people who are severely depressed could stay in the house and do not go out, stay in their bedroom, and their personal hygiene could be really one thing, and they could be smelly. So it's quite important that you don't avoid them. Be proactive and patient. Try to talk to them, because when they don't want to go out, they don't want to speak to anybody, just go, give them a hug, give them a hot drink, just make your presence felt. Try to take them for a walk. Open the window blind so that sunlight could enter into the room. Give them food. Try to cook so that the smell could change their emotions. Try relaxation technique like deep breathing and exercise. Encourage exercises and socializing. Try to bring your friends around so that they could talk to them and help. Human contact actually helps people who are depressed. What to do when they don't want help, especially in our community? As I mentioned before, just listen to them at time and then ask them what is going on, and don't judge. Be very patient. As I mentioned earlier, be proactive. Talk to someone, a friend, family member. Do not put them in any pressure. Do not avoid them. And there are things that we should not do. Don't say, there you go again. It's just in your mind. Calm down and get over it. You are anxious over nothing. Everything is going to be okay. No, they're feeling bad. So it wouldn't be like that. Stop acting like that. I know exactly how you feel. Actually, you don't, and we don't, because everybody feels and things differently. And sometimes the family member could feel like, oh, it's because of them that the loved one is feeling that way. Now, what to do? We could ask help from GP and ask professional help, or NHS 111 as well. It's a place to look. We also have online resources that could help, like patient health questionnaire and so on. In summary, mental health is common, and mostly anxiety and depression is very common in our community. Do not invalidate the feeling of your loved ones. Look for signs and changes that last for more than 2 weeks. Trust your own judgment. Listen to them. Be available, be proactive, and seek help. And please remember, when somebody has a mental illness, it's the whole family that is ill. Thank you.
Okay, thank you very much. This is a really important topic. And so it's very important that we know about it and we know what to look out for. Again, in the Q&A, we don't have any questions coming through at the moment, so I'll take Chairman's prerogative again. Now, obviously, you've pointed out to us the things we can do, A, to recognize that someone close to us is going through a mental health breakdown. And secondly, what to do about it, what we can do about it. Thirdly, you've mentioned where we can seek external help. Okay. So what I would like to know is, at what point do you transition from trying to help yourself, you as an individual trying to help your loved one with the measures you've mentioned, to thinking, okay, I need to seek help now. I need to phone the GP or NHS 111. How do you recognize that point where it's gone beyond what you can do and you have to seek professional help?
That's what I said, to trust your judgment. Because you know your loved one, if you're trying to do things and you're saying that things are not going in the right direction, then you know everything that you've done is not working. If you've spoken to family and friends and they've come around and the patient is only going downhill, my suggestion would be to do an e-consult and talk and send to the GP. And the GP would actually reply on the e-consult and give you some advice. The reason I'm saying e-consult is because nowadays, most of the time, GP will not do a face-to-face. So there's an online type of consultation that could take place. And that's one thing to do. So one should talk to their GP. You could go and book an appointment to see the GP, because sometimes the person who is depressed does not actually know that they're depressed. So that's the problem, because somebody is not aware that they're depressed, but you're feeling threatened by them being in the house, or they're staying in their room, they're not coming out, they're not coming even to eat, then you know something is wrong. So it at some point is to ask the GP to do a home visit. You could do that, and the GP would come and visit the patient at home. So what I'm trying to say, trust your judgment. If you think things are not going the way you think they should go, ask the GP, ask to see the GP, and ask the GP to visit the home and talk to the patient themselves.
Okay, thank you. We have got a question come through the Q&A box. So someone wants to know, how easy is it to access counselling on the NHS?
Unfortunately, due to manning, which is manpower, it takes about 6 weeks to seek or to have counseling via NHS. I think Humphrey will have better time frame on that than me. But where I work as a military doctor, we take about 2 weeks, but under the NHS, it's not the same. So they take about 6 weeks. So we have what we call 3 levels. Level 1, we treat them as in primary care. Then level 2, that we refer them to the mental health team. And then level 3, they see a psychologist as well, and they have weekly treatment, which I know it will be difficult to say that is what happened under the NHS. Humphrey, I think I will need you to say something on that.
I think you're correct. I mean, the time scale would depend on the services, but generally speaking, most of the services I've worked with, you're right. Sometimes within 2 to 6 weeks, you could prioritize. If it's really urgent, you could push and see how they could bring the case forward. But counseling generally, I think, is of all the psychological interventions, I think it's the most common, because usually the professionals, maybe nurses or therapists, support workers who have been trained in supporting people with some basic psychological resources. So it is widely available compared to other higher psychological interventions. And if you're struggling and you can't get it within the NHS, there are lots of charities, from mine to, depending on what the issues are. There's around bereavement, you could go to Cruise. There's mine, there are other charities out there that could help. I'm sure even some churches do have services that, can help with counseling. I'm also sure that there are lots of NGOs out there that could help with counseling. It's a very basic skill, so it's widely available. You don't need to wait to get it from the NHS if it's going to be that long for you to achieve it or to get it. Thank you.
Okay, thank you, Humphrey. That's really helpful and really useful. Nkwayep, one more question directed at you. Thank you, Dr. Nkwayep. Is it that easy to get the GP to do a home visit, especially with COVID?
No, it's not that easy. However, if the situation required, the GP would do a home visit. I'm not going to say, and it also depends on the area. But some GP do visit quite easily because they have a lot of patients that are not mobile, so they have to do home visit to see the patient anyway. So, but to do home visit, that I think some GPs will require that the patient cannot come to the surgery. There are certain things that they will have to go through, and then make sure they will call the patient, try to speak to the patient. But if you insist that the patient does not want to speak to anybody and they don't want to talk and they're only in your room, the GP will feel compelled to come and see them. And then I think they will come and see the patient at home.
Okay, thank you. Humphrey, there's another sort of question or more comment directed at you. Someone's asking if you could please send links to other forms of counselling you've just mentioned. So I think what you might be able to do is behind the scenes liaise with Anna, and she'll make sure that this is, she'll let us know where this will be available. Whatever you give her is available for people to access. Is that okay?
So can I just be clear on what the question is? So it links to other forms.
So links to other forms of counseling, which you mentioned, NGOs, churches, all of that.
Services that could provide counseling.
Yeah. So if you know any links,
okay,
let them know. We could potentially put them on CamDoc for people to access.
Okay.
Okay. Thank you very much, Nkwayep, for that really interesting talk. Now, our next speaker is Mrs. Rose Hombo, who is the divisional lead nurse for Oxford Health. Now, Rose has sort of over 25 years experience as working as a mental health nurse in the NHS, various roles. In addition to that, she's also the current president for the Cameroon Nurses Association in the UK. So obviously our sister association. Mm-hmm. So what Rose is going to talk to us about is how to look after our mental health and simple tips which we can do and use as individuals. So, Rose.
Thank you, Dr. Ayuk. I'm just going to, good to be here and good evening, everyone. I'm going to try and share my slides, but I'll talk to you guys. I'll talk to you as I go along. So, bear with me. So that's me. I'm Rose Hombo, as you've heard. I'm going to be looking at how we look after our mental health, particularly during this COVID period. We all know that COVID has been, to me, it feels like 2 years, but we know that it's just a year old. We know that mental health, good mental health, is as good as physical health. We know that we cannot have good physical health without mental health. And coping with our mental health during this period of COVID is quite uncertain. So taking care of your mental health is absolutely paramount. How do we do that? There is something which, again, for some of us who is out there in the literatures, there's a lot of literature which the government and Department of England has put out. But there's something that I call Take 5. So there are 5 simple steps that we could do. remember that this is not going to last forever. So COVID is here. We would need to live with COVID, but we also need to look after ourselves. So what does take 5 means to me? The first thing that we need to try and do is to stay connected. Connected with the people around you, your family, your friends, your neighbors, your local community, and your work colleagues. And we also know that there are guidelines. We also know that we cannot do the things that we used to do before, which is go out in clusters or go out in groups, hug each other. But what we could do, most of us now have become what I describe as technology savvy. Even 90-year-old grandfathers, grandmothers, they're all great-grandparents, they're all using digital phones and sort of technology. So we could do those by WhatsApp, Messenger, Twitter. We've got all that at our hand. So we could use that to connect. Be active. It is important to find ways to be active, no matter how small, no matter how many minutes. Well, most places are just starting to get open now, but we don't know what the future holds. So anything that you could do to be active would be really helpful. So under the take 5, take notice is the third thing. We work a lot. We don't go out that much these days. So we need to think about stopping, pause, take note, and look around you. We have to keep learning different ways to do things, different ways to enjoy ourselves again. Use new ways of discovering different things. Learning how to give different ways of, achievements, i.e., some people never used to cook before, but then with the closure of restaurants, we need to try and do things like that. Things that would build your confidence, things that would give you opportunity to share or to enhance yourself during this time. So keep learning. And the fifth thing under that would be give. What does that mean? We are all in a community. We need that social distancing and guidelines for us to be able to do that. For me, the greatest gift that you can give anyone is to do just the basic things, to be nice to a friend, to a neighbor, to smile. Just giving a smile doesn't cost anything, and that helps us. So that's my first bit about take 5. How do we cope? With our moods and feeling these days, particularly the fact that most of us could be isolated at home, working from home. Reduce the amount of time that you spend listening to news or browsing on social media, because there are a lot of messages out there, and sometimes the validity or the reliability of those messages or information can be very conflicting, particularly around the topic COVID. Let's go of what we can control. So do what we can control. Don't worry about those things that you cannot control. Acknowledge your thoughts, acknowledge your feelings. Be kind to yourself. It is normal during this period for us to feel a bit different. But as you've heard from the last 2 speakers, when those feelings, when they prolong after 2 weeks and they're constant, then you might need to do something else. Listen to music. There are things that you could do on your own without a second person. Think about, there are a lot of relaxation apps. So rather than listening to a lot of social media and a lot of conflicting information that are out there around COVID, it would be good to do those relaxation apps and videos. You've heard again about this time around, because we are so isolated, it's very easy to get into bad behaviors, i.e., people start drinking a bit more, probably start using substance. Avoid those. Avoid unhealthy pattern of behavior. So that's how we can cope with our moods and feelings on a day-to-day basis. Most of us work from home. Most people, to limit the infection spread, the spreading of the infection, we are being asked to stay at home and work from home as much as we can. How do we cope with that? I think one of the good things that is easier said than done, is that because it's a new situation, what we need to try and do is create a routine. The fact that you're working from home does not mean that you need to stay on your laptop or your computer for 24 hours. Create a routine, try and maintain that routine. If you are a parent or a carer with young children, try and develop a routine for them as well. And let your routine include your kids. I think that's really helpful. And the routine that you want to create for yourself is not something which is tedious. Even things like, as I've said, learning how to cook, reading, even tidying up, and just climbing stairs in your house, that would be really helpful. I've already talked about building in physical activity. So building in physical activity in your day-to-day work is really helpful. Physical activity, which is not necessarily, climbing on bikes or riding bikes or lifting, just physical activity that includes cleaning the house, climbing the stairs, going outdoors for fresh air, spending time in the garden, spending time in the balcony, open your door for fresh air. And then eating and sleeping is also, we really need to eat well, we need to sleep well as well. So coping with staying at home and working from home, those are some of the practical things that we could do. How do we then cope with children? Coping with children. It is very important. Sometimes we don't give our kids we think that they're like us, or they were brought up the way we were brought up. We don't give them enough due that they deserve. They've got resilience, and we need to try and build those resilience with them. It's important to talk to children. It's important to bring them in your world, to explain what is happening in them. Because most of our children would have heard about Corona. They will see people wearing face masks on television, and they will want to know. They hear it in school. So talk to them. Take time to talk to the kids. Don't be afraid to ask questions. So ask them what they've heard. Ask them what their understanding is. Try to minimize the negative stories that they hear on TV, from their friends, from your neighbors, and news. Try to minimize those. Children sometimes would feel relief if they can express themselves and if they can communicate their feelings. So be supportive. They like to do that in a supportive and safe environment. And if we can create that environment for them to be supportive, then to tell us how they're feeling. Engage with the children. Be creative. Find out their interests. Those are the things that will help us during this period to cope with our children at home. Some of us will be doing tutoring as well as working. So if you build a structure and include that tutoring inside and give yourself breaks, things like taking them out for walks. So when they're on break, for those people who are homeschooling, I think that's really helpful. How do we then cope with our older ones? Some of us have got older relatives. Some of us are carers. We have our mothers and fathers that we look after. They live with us, or they live a bit further away from us. So share the simple facts about what is going on. Don't hide it from them. Listen to what they're saying. Give them clear information, but be concise about the infection to their own level of understanding. Repeat information where it's necessary. We know how some of our older people, some of them might have dementia, some of them might have Alzheimer. They repeat the information to their level. Keep regular contact, be it face-to-face, particularly if they live at home with you or they live somewhere else. But when you keep in the contact, ensure that if you don't live in the same bubble, they don't live in your house, or you're not in the same bubble with them, then definitely ensure that you have protective equipment. Get them involved in activities, simple activities, home activities, physical activities, word puzzles, game boards, give little chores at home. They can do that just to keep them busy, and hopefully try and ensure that they get a well-balanced diet and good sleep. Coping with loss. You would have heard that most of us from the last speakers, we cope with loss differently. So the simple tips that I would like to share in terms of coping with loss is talking. Some of us, most of you would have heard about get breathing, talking again. So talk about your feelings. Talk about how good or bad things are. There will be people that you trust. Talk to people, your loved ones. Talk to your friends. Talk to your work colleagues. We've already heard about things around bereavement counseling. And again, coping with loss is not just loss of a human, somebody. It's loss of job, loss of income, loss of livelihood. So talk about it. Be kind to yourself. For many people facing job losses or financial difficulties, it's nothing to do with you as a person. It's the circumstance that we find ourselves. So blaming yourself does not necessarily help you. Try and think of what you can control. Again, maintaining a routine, having a daily structure would help you. And particularly when it comes to financial hardship or struggles, creating a budget where you've got, working out a plan, that also does help. And some of the stresses that we go through during this period would mean that regardless of whatever we've done, some of us, it'll be okay, some others will not be okay. For those who is not okay, and the sort of stress or the symptoms or whatever it is that you're experiencing carries on for after a period of time, there are help. You're not alone. Seek help. There are help. Humphrey already started by giving you some of the help that is out there in your local community. If in doubt, your GP would always signpost you to the relevant areas. So the slide that I'm showing now, you would see some of the helplines that are available there, like mine, like the National Lifeline, Citizen Advice Bureau, Step Change for Debt Charity, and then the National Debt Line. Again, there's quite a lot of domestic violence or issues going on currently, there are helplines available in your local community, at work. So please do not die in silence. And I'm going to stop there because I think I've gone above my time.
Okay, thank you very much, Rose. That was really helpful and really interesting. Can I just say to the audience, a lot of the help groups you mentioned, and which were mentioned previously by Nkwayep, we've put the links in the chat. So for the audience, we put the links in the chat, and we'll also be putting them on the CamDocUK website. So you can go there to find those links. So Rose, can I just, I don't think there's any questions in the Q&A for you. So could I just ask, one of the things you talked about is talking, talking about your feelings and, letting things out. As you know, that this is something which particularly, African men are not good at doing. So have you got any advice for us, any tips?
Yes, men generally, I don't think it's only African men. I think men generally, women, we talk a lot, so that gets, it does get easy. It's in the bloodstream or in the pattern. I think the advice is, the reason why men don't talk or don't disclose information easily, possibly is the whole thing about a man is a man and the sort of macho-ness around men, stereotype kind ideas, men don't cry and stuff like that. But I think things have moved on now. We are in the 21st century. Again, if our partners or spouse or husbands or brothers can't speak, for those of us living with them, for those of us related to them, just as Nkwayep was saying, keep an eye, encourage them, and just keep encouraged. There will be somebody that either your husband or your spouse or your brother can relate to, that you can get them to open up. But I'll encourage most men or even women just to keep an eye on the men and also encourage them to talk. It does get better as soon as you take the first step, but do try and take the first step. And again, sometimes there are some people who don't talk. They find talking quite difficult. I think the best we can do for some of those people that we live with or relate to, the friends that we have who we know very well, is to observe a change in their behavior and their pattern and try and seek help for them.
Okay, so another question has just come through, and this is open to all the panelists. Let's see here if we got. So, and probably I'll direct this one to Nkwayep for starts. What the attendee would like to know is, what can we do if we are concerned about our relative, but they don't want to seek help? Could we call a GP on their behalf?
The answer, if we're quite worried, the answer is yes. Because it's our loved one, and then we want the best of care for them. So we could call the GP and talk to the GP. However, because of confidentiality, the GP may not be able to tell the person that this is what has been going on with your loved one. However, if the person is below 13 years old, is a child, then the GP will have to talk about to you about everything about the patient. I said 13 because we have it's the age where you could consent. Though we say 16, but with the guilty competency, that's where you could actually consent. So the answer that I would say is that yes, you could talk about it. The GP will listen, but the GP could give you some advice about how to deal with it, how to bring your loved one to come to see them. And as we mentioned before, you need to listen to your partner or your loved one, and then ask them if they could write, to write the way they feel. I could say, if you're severely depressed, you don't want to see anybody. You just stay indoors. You stay, when I say indoors, you stay in a room and you try to close the blind, everything. So by just opening the blind, make sunlight to come in, just come in there and give them a hug and something warm, human presence could bring them to actually seek help, because you're showing them that they're doing something that they don't do often. And the people who are severely depressed, they would not do any personal hygiene, nothing. And if there is question of suicide, of course you need to call the GP. And of course the GP will have to come, because they could actually section the patient and then take them for treatment if need be. I think Humphrey would know about this, because maybe they've had it in their cases before. Would you have to section the patient to treat them? Thank you.
Thank you, Nkwayep. Humphrey, anything to add?
Yeah, I think so, people have the right to deny treatment. So, and if they deem to have the capacity, so if they understand what the issues are, they could retain the information, they could weigh the pros and cons, and they could make a decision, then you cannot impose treatment on them. You can observe closely, but like Nkwayep said, there is a threshold that the state can intervene, and there are very clear legal guidelines to go about it. So if for any reason, someone who, is say in the community under reasonable suspicion that they're suffering from a serious mental illness that necessitate an assessment or treatment in a hospital, then in that case, you go ask for what is called a mental health act assessment, where you get two independent doctors and a social worker, and they come and they assess the guy or the lady, and they make a decision whether it is in the interest of the state or in his interest to take him to a hospital against his will and to treat him. And there are two ways to go about it, and each of them has different durations. One of them is a section 2, where you could say there's enough grounds that this guy have a mental illness. I want him to be taken to a hospital for an assessment, and that gives you legal powers to detain him for, say, a 28-day period for that assessment. And there is another one which is referred to as section 3, and that is usually for someone who has an established mental illness, who is have a recurrence of the system and doesn't want to go to the hospital for treatment. You can apply that section 3, which gives you enough powers to detain him in a hospital for over, I think, for three months. Then the police also have powers. So if you're acting disorderly in the public, and the police are worried that there might be enough grounds to raise concerns about your mental health, the police have powers. I think it's section 136. They could detain you, take you to a place of safety, where they could bring 2 doctors and a social worker to assess you, decide whether or not you have a mental illness or not. So there are safeguards in place, but usually they're triggered when the threshold is really high. So if you're just unwell and you're coping well, then it is very unlikely that it would meet the threshold. So in that case, you go about what Nkwayep said, just see how you could encourage them and use people that they might be familiar with, colleagues, friends, and neighbors, to get them to seek treatment.
Okay, thank you. And one more question has come through for you, Humphrey. If you could just give a quick, in the interest of time, and just a quick answer to this one, so we can move on to the next talk. Dr. Humphrey, have you seen an increase in exacerbations of mental health conditions in your practice? And are you still able to see your patients in person, face to face? So
I'll start with the second question. So I do, most of my reviews are done virtually, but like I said, we are obliged to carry out mental health assessments, with in-person contact. So up until, I think, about March or so, we could we could carry out mental health assessment virtually, but there was a court ruling that stopped that from happening. So my routine work is done virtually. I do video telephone reviews, but if I have to go out to decide on whether I want to detain someone to take them in for treatment, which is what I meant by a mental health assessment, for that to meet the legal threshold, I need to go in and carry out an in-person assessment. And asking whether there's an exacerbation of mental illnesses, of course. So as a matter of fact, I've never been as busy as I am now. So those who have been, in remission, settled, their routines have been disrupted. Some of them, like I said, their support systems were interrupted, and medications were not available at the right time. So the answer is yes, we're seeing an exacerbation.
Okay. All right. Thank you very much for those answers, Humphrey. I think we need to move on in the interest of time. So our final speaker, last but not least, is Dr. Njang Emmanuel. Now, obviously, as you all know, I know we're all based here and most of us in the UK, but as you all also know, the CAM in CamDocUK stands for Cameroon. So, our webinar would not be complete if we did not get a perspective from Cameroon, and that is what Dr. Njang Emmanuel is going to give us. So Dr. Njang Emmanuel works in the Moyoka district, and he's responsible for overseeing the 21 hospitals in that district. So they all fall under his jurisdiction. He's also the president of the University of Buea Medical School Alumni Association. So, Dr. Njang.
Yes, good evening all.
Good evening.
Thank you for this wonderful opportunity to share some ideas, some great minds. So I'll be talking about the state of mental health amidst COVID-19 in Cameroon. So before I begin, I would like to say that I'm very emotional when talking about mental health in Cameroon, because it is a field that is underexploited. It is a field where there are a lot of gaps. It is a field where there's still a lot of work to be done. So, but going back to the subject matter, since 2017, when I graduated as a general practitioner, I started working in the Northwest region. And shortly after the crisis started, so up to date, my 4 years of practice has been in the crisis affected regions, and it's been terrible because before the crisis started, there was already a burden of communicable and non-communicable disease, which was affecting the lives of the socioeconomic lives of our population. Then the crisis came. When the crisis came, landlords became tenants, businessmen became very poor. So again, it had a toll on mental health in our community, coupled with the pre-existing burden of the communicable and non-communicable disease. And to make things worse, the COVID-19 pandemic started. This is a myriad of issues that if we can attach the rise in domestic violence in homes, if we attach the penetration of substance abuse in our schools, and so many other issues that affect our community at this time. So meanwhile, we are trying to push back these issues, we are neglecting the impact it has on mental health. Suicide rates are rising, even though there's no data to back it up. But for those of us who have grown here, those of us who are living here, we are seeing that these rates are increasing at an alarming rate, even though there's no data to back it up. And again, at the back end of all of this burden is transferred to health personnel because we receive these patients on the daily basis. And to be able to suck out all of that despair from the patients, coupled with your own personal experiences as an individual, as a community, and as a general practitioner, at times we healthcare workers endure the most severe toll on mental health. And then we are again frustrated further because one, we do not have infrastructure, we do not have tools, we do not have knowledge, we do not have capacity to to even try to approach this mental health condition. So we are a bit lost, I must say. We don't know where to go. We don't know what to do. We don't know how to approach it. So it is not like that as president of the University of America Alumni, we decided to start from advocacy. That's why we organized our second edition on mental health, because we brought together the future Air Force, which are medical students, the current Air Force, which are doctors, nurses, and then the community, so that we should make them to be mental health aware. And in 3 days, we spoke about a lot of things. We spoke about suicide, spoke about depression, we spoke about anxiety, we spoke about so many things. And it was really refreshing because most of us who were in that hall at that time, at some point we were depressed and we didn't even know we were depressed. Most of us had come across with a neighbor, a sibling, a patient who was depressed, and we did not even know how to go about with that patient, how to refer that patient. So in the midst of the pandemic, we are a bit lost in how to approach mental health from the perspective of the health personnel. If I see somebody who has a problem with substance abuse, where do I send the patient to? If I identify the trigger, how do I help this patient? So concerning mental health in Cameroon, it is already there, and then the COVID pandemic has come to worsen it. The socio-economic, socio-political crisis, which is stagnant, is also worsening it. So at this moment, unfortunately, we do not have data to back this up, but for those of us who are in the community, those of us who are in the ground, that is the perspective, or that is the approach, or that is the overview of the mental health situation in Cameroon, particularly in the Northwest and Southwest, in the background of the COVID pandemic. Thank you very much.
Okay, thank you so much, Dr. Njang. That's really, really useful. It's really, at least we know that with people like you back home, that this issue is, being talked about. It is coming to the open because, like you said, it's very, under-recognized in back home. So a question for you. Someone say, thank you for your insight. What is morale like for you and your colleagues back home at the moment?
To say the least, I would say that it's not really the best. Healthcare professionals, doctors, we don't know where to go to. I would say that because people come to us with their problems, but we don't really have where to go to aside our friends and family. So we are just trying now as an alumni to try to meet up as many times as possible. Of course, respecting barrier measures to be able to encourage ourselves. But sometimes we feel abandoned. Sometimes there's the element of despair which causes your mind, because the system is very hostile. There's the problem of the welfare of the workers. You don't know how your future will look like in the next 5 years because you don't know how things are going to be. It has become more stringent in getting scholarships and all that with the COVID pandemic. So I won't lie to you that at this moment, practicing in Cameroon is harder than before, and it's even harder working from the Northwest and Southwest region. But despite that, we continue to serve.
Okay, yeah, thanks for your answer, and thank you for all the hard work that you guys are doing back home. So now we can open up a sort of short general discussion. I know we've come to what was meant to be our finishing time, but if people want, we can spend another sort of 10, 15 minutes talking about this. Another question has come through for you, Dr. Njang, asking, how can we help? Are there any charities in Cameroon which would be, we could help through?
Well, permit me to use this platform to say that the University of America School alumni is very keen to rekindle the wonderful relationship that we had with CamDocUK, because in 2016 we organized the first ever continuous medical education session in Cameroon on cardiac pathologies, where we had over 150 health personnel enrolled. So we need people who can trust us to implement certain programs or certain projects that will benefit our community. I understand that there's a problem of someone who is credible, someone who has integrity. But if you want to ask how you can help us, is that we have to look for a way to find a common ground for us to work together. I, for one, I know that CamDocUK has its community at heart. But I know that the problem that CamDocUK has is who is trustworthy and who is credible. So I would like to implore that we should look for a way to meet halfway. And there are other credible organizations like Hero Cameroon, which has had the distinct pleasure of working with CamDocUK. I think that we who are here can be the bridge between CamDocUK and our community, because I am very sure that CamDocUK has a lot in store. It is about bringing it back home.
Okay, yeah, thank you. I can see you're driving, so you probably can't do the chat at the moment, but would it be possible maybe for you to link up with Linda and just let her know if you guys, if there's a link or website or whatever, which we can promote through our CamDoc website, so people who not just CamDoc, but this came from just a member, one of the attendees asking what they can do to help. So it'll be good if there's a link which they can also access possibly through CamDocUK to make contact with you guys. Would that be okay?
Definitely, I love that.
Thank you. So can I just remind all our attendees that there's we've posted a survey in the chat, so we'd be really grateful if you could fill this in. Dr. Njang, just a comment from one of our CamDoc founder members, Dr. Theodore Ngachu, who's saying it was a pleasure listening to your presentation about the situation of the medical professional in Cameroon, particularly in the Northwest and the Southwest. I don't know if you know Dr. Ngachu, because he comes back home quite often to do talks and teaching at the university.
Yes, I've had the pleasure of interacting with Prof, and
great.
we have even worked on a project.
Okay, so looking in the Q&A, there's a question there, which I suppose probably best goes to Humphrey and Nkwayep. So what do you do if a friend or partner becomes confrontational, not accepting that they are either depressed or anxious? And how can you sort of cause them to get them to seek medical attention? In fact, our current chair of CamDoc, Dr. Linda Bello, would like to answer that question. So Linda, we haven't heard your voice. Come on.
Actually, I was going to say that the question had already been answered.
Oh, is that what you were going to say? Okay.
Yes, but I can just highlight what they've said, and I think Dr. Mpafe did answer most of it as well. So if they're becoming confrontational, basically you can always call up the GP and speak on their behalf, and we can always give you advice on what to do. But obviously being confrontational is part of the issue that they're facing, so we should always remember that. So trying to be patient, trying to just let them talk it out is more important. But if at any point that you feel that they are at risk to themselves, then obviously there are all the things we spoke about in terms of sectioning, which Dr. Humphrey has spoken about. So the main thing is really try and be understanding. If you're really struggling, call the GP on their behalf. I take a lot of calls as a GP. I take a lot of calls from people calling on people's behalf. As Dr. Mpafe said, we wouldn't tell you about their medical condition, but that would prompt us to call them, to speak to them about what they might be facing. And as Dr. Mpafe said, also, coming to the house with them, opening the door, opening the windows, going for a walk with them. These are all sort of very simple things that can be done. But if at any point you feel you can't cope, speak to us, GPs. We're really easily accessible, yeah. So that's the main thing I wanted to add, and to say that it had actually already been answered.
Thank you, Linda. Thank you very much. Okay, so I don't think we have any more questions coming through. So in that case, what I would like to do is thank all of our attendees And I can see quite a few of the attendees are thanking us and saying, they appreciate what we're doing for the community with these webinars. So they will continue, and we'd love you to join us. We put the survey out there so you can tell us if there are specific topics you would like us to talk about. So, don't hesitate to tell us. We're doing, we're trying to do this for the community, not, so we want to give you what's interesting for you. So in that case, I'd say thank you very much for attending, and we look forward to seeing you